Hi, everyone. I'm Leann Lewis, and as Dr. Statland introduced me in the beginning, I am the FSHD coordinator at the University of Rochester, working primarily with Dr. Rabi Tawil and Kate Eichinger, and I'm also the lead coordinator with the FSHD Clinical Trial Research Network, so I get to work with Dr. Statland and his team a lot. So I wanted to talk about how this all kind of came about too. Back in April, when everything was happening with COVID and a lot of our research studies got shut down because everything was closing, we were all chatting, Dr. Statland and Dr. Twill and everybody, and Dr. Statland came up with this idea of, we should really look at how this pandemic may be affecting people with muscular dystrophy and what types of challenges they are seeing so that we can help improve their care during this period. So this survey was what focused on that. Sorry, it only takes a second to advance. Anytime now. It's not wanting to go. Don't know why I can't get it to go now. Oh, there it goes. All right, sorry about that. So we created this survey, and we being researchers at the University of Rochester, Kansas University, and Virginia Commonwealth University, we really take a team approach to a lot of these things. And then we also got feedback from other researchers before we completed the survey. So we asked other researchers in muscular dystrophy, other organizations and advocacy groups like the FSHD Society, as well as patients, because they always come up with things that we don't think about that would be very helpful. We also included the perceived stress scale, which is a previously developed survey that's already been verified in several different studies over the years. It was created by a doctor at Carnegie Mellon, and we figured, people are experiencing stress during this time, so this gave us a more quantifiable way to look at how they were perceiving their stress. We distributed the survey to all the different registries and advocacy groups with people who had FSHD, myotonic dystrophy, and limb-girdle muscular dystrophy. And we chose those three because they're the most common that we see in adults with muscular dystrophy. Duchenne muscular dystrophy is more common as well, but it's more common in children. And we decided to exclude that just because it would provide a different set of questions for the kids and their care providers. We distributed the survey through the month of May, so within the first couple months of the pandemic. We really wanted to get it out fast because some of our research projects were on hiatus, so it kind of gave us something to do as well. But then two, just so that we really could get some answers quickly. And so as you know, our goal was to look at the social and health impacts of the pandemic and social policies such as social distancing and how those things affected people with muscular dystrophy and how we could better provide better care during this time. So the survey asked questions about demographics like age and genetic diagnosis and location. Most people reported that they actually had genetic confirmation of their disease. And then we, of course, asked about COVID-19 and if they had been affected or anyone in their household had been affected. And at this point, being so early on, we found that less than 1% of our respondents actually had COVID-19. So about 7 individuals said they had it, and then 5 of people in their home had it. So it didn't really give us a whole lot of information at that point. If we were to repeat the study now, we'd probably see higher numbers and be able to get a little bit more data from that. We also asked several different questions in different categories such as exercise, pain, mental health, and medical care. And some of these, again, were feedback from our patients and other muscular dystrophy experts, especially considering exercise and pain were 2 common themes that we saw. And of course, we wanted to ask about telemedicine, as this was relatively new for a lot of patients and new for a lot of institutions. a lot of institutions had to quickly get this set up, and we wanted to see how successful it was being for people. And of course, as researchers, we wanted to know how the pandemic was affecting their research study participation and their willingness to continue participating in a study through this period. And as I said before, we also included the perceived stress scale, which is a 10-item or 10-question scale to basically ask about their perceived stress during that time. We had over 1,300 participants from across the world. As you can see, a majority of our participants were from the United States, about 2/3. And then we also had a lot from the UK, because we actually distributed this survey to the UK's registry as well. And then we had 132 from Europe and 52 in Canada, 30 in total from all of the Asian countries, 19 in Australia, and 11 from South America. So there was a nice spread. The participant characteristics, a majority of our respondents did have FSHD, and then followed by myotonic dystrophy and limb girdle. About 48 participants did not report a diagnosis or reported something else. But for the majority of it, it was those 3 diagnoses. And as you'll also see on the bar graph on the right, it was predominantly females who responded. So we have more data from them. And as far as age range, the average age range was about 53, which is what we saw in people with FSHD. And then we asked a question about participants who lived alone versus with others. We figured that there would be some data about that as far as getting help with care or doing household chores or obtaining essentials. And most of our respondents said that they did live with others. So we had very few that said they lived alone. So we weren't able to get weren't able to make a lot of significant conclusions from that as far as significant challenges people living alone might have had. And then we also looked into mobility or wheelchair use, asking how often they use a wheelchair, if at all. And you'll see across the board, the majority of participants reported not using a wheelchair. And Kate will get into that a little bit later. And then, of course, we asked the question about challenges faced during the pandemic. And the major response was obtaining treatment, as obviously doctors' visits were canceled or rescheduled as everyone was figuring out what to do. And then followed by social distancing, obtaining essentials, and stress management. And so it was, stress definitely was something that came up several times. So it was nice to see, or nice to have the perceived stress scale in there so that we could delve into that a little bit further. And we always ask other, because people always come up with responses that we did not think of. So these were the other responses that people gave us as far as other challenges during the pandemic. So exercise, because gyms were obviously closed at that time, so they weren't able to exercise. Mental health issues such as depression and anxiety and boredom, feeling isolated, performing household chores was a challenge, and that might be more for people who were living alone. Homeschooling, as obviously schools had closed, and not being able to attend church and working more hours. And we also asked a question about the types of challenges due to social distancing, which seems to be the kind of across the board social policy that was implemented in most places. And so the main response that wasn't too surprising was feeling alone during social distancing, as well as performing daily tasks and receiving care. So again, that might be coming from people who obviously depend on others to help them with the daily tasks and obviously getting care. And then for our other responses, again, exercise was another thing that came up that we'll get into again later. And attending appointments, work, as far as people not being able to attend work. So some people were furloughed or had to work from home, which presented challenges. Childcare, obviously, as schools and daycares had closed. mental health issues, getting supplies. And a few people actually gave this response too, was standing in line for long periods. Many people get fatigued after standing for a long period. And so with social distancing and having to stay apart, people were finding their wait times to be a lot longer. So that was an interesting point that people made. So I will now hand it off to Kate.
Hi. So I'll just continue going through some of the data that we had. So this looked at the impact of the pandemic on muscle disease in particular. So the majority of patients reported that their muscle disease had not changed, and that's represented by the gray bars here. And you can see, FSHD, myotonic dystrophy, limb girdle, and then overall. So overall, not surprising that these that people reported things that either had not changed or had a slight change, given that these are progressive conditions. However, it was more interesting to look at the smaller percentages of people who reported that their condition had actually improved during the pandemic. And so when we dug into this a little bit deeper, we found that these individuals that reported that their condition had improved during the pandemic also reported that they had had an increase in their exercise. They had reported an improvement in their pain level, and then they reported that they were able to manage their stress. And then in contrast, there was a smaller percentage of people who reported that their muscle disease was much worse during the pandemic or at that time. And these individuals reported that there were fewer of them exercising or that their exercise had decreased. They reported that their pain had increased. And that in terms of stress, that only 44% of them said that they were able to manage their stress, which we'll talk a bit about later, but was a much lower percentage than the overall report of managing stress. So again, I think it was more interesting to kind of look at those two extremes, and that can help us think about how we can help manage and provide recommendations for our care and during our care. We also looked at pain. We know that many participants experience pain, and that was something that patients and advocacy groups had suggested that we include in our survey. And so you can see on the chart on the left that about 74% of patients reported pain. And then we asked about individuals to rate what their pain was before the pandemic, as well as what their current pain level was. On a 0 to 100 scale, so we could have a numeric version of what their pain representation was. And on an average, patients reported an increase in their pain level during the pandemic, or at the beginning of the pandemic, I should say. We also asked about exercise. So about 60% of participants reported that they were engaging in exercise. And really at the time of the survey, so back in early May, exercise was a bit more challenging. The gyms were closed, pools were closed, and in the northern United States, it was still pretty chilly out. We had a cold spring. So it wasn't surprising that 43% of participants reported that their exercise had decreased during this time. And you can see that that was true in FSHD as well. So just over 20% reported an increase, 45% reported a decrease, and just over 30% reported that their exercise had been unchanged given the situation. And like Leann's book, we asked about stress levels, and we used the perceived stress scale to determine how people thought or perceive their stress. And basically this scale is 10 questions, and it asks about feelings and thoughts related to stress over the past month. Each item is scored 0 to 4, which gives a total score of 0 to 40, with higher scores indicating more stress. And then you can break it down saying that a score of 0 to 13 would be low stress, 14 to 26 is moderate stress, and that a score greater than 26 was severe stress. And so in our group here, individuals with neuromuscular conditions reported moderate stress levels across all diagnoses, and individuals with FSHD actually reported lower stress than the other two conditions. We also noted that females and those under the age of 30 reported higher stress levels, as you can see here, and that was similar to what had been reported in studies at the time in the general population. We found that there was no difference in stress between people who were ambulatory versus those people that were using a wheelchair. And overall, our numbers may be influenced a little bit by the fact that there were more women who completed the study. So when we adjusted for this, we didn't find differences in the different diagnoses between those groups. And I think again, these trends seem to be, at least at the time, trending with what the general population was dealing with from a stress standpoint. We asked about stress management, so and how people were managing their stress, and the majority of people did report that they were able to manage their stress. I think that was around 88% reported that. And then you can see here how people were managing their stress, and really at the time most people were managing their stress by sleeping or resting, followed by exercise, and then meditation were the largest categories of the ways that people were managing stress. We also, again, asked about other ways that people were managing stress. And this is a word cloud, or a graphical representation of the other ways that people reported managing stress. The larger the word, the more frequently it was reported by participants. And you can see here that family, friends, prayer, reading and talking. And then if you look in all the smaller text, it's really a lot of different hobbies that people were reporting to. So I think if we left the category of hobby, it would be a pretty large reported other way of people managing their stress. So telemedicine. So telemedicine is doing virtually medical visits virtually over either a telephone call, or probably most commonly doing a video platform at this point. And it had always been an interest in the medical field, and in particular to neuromuscular medicine, because it offers benefits to care. It may allow patients to access neuromuscular specialists if they don't have one in their community. It can help reduce travel burden for patients when it becomes difficult to travel because of mobility issues, or the time that it takes for people to take time off of work, either themselves or their caregivers, to attend medical appointments. So there was always kind of an interest in this, and while there were small instances of this being in place, the pandemic certainly expedited this process as medical care really shifted to telemedicine during the early phase of the pandemic. So as part of our survey, we did ask patients about their experiences with telemedicine, including all different types of providers, so not just neuromuscular providers. And overall, 75% of individuals reported that they were satisfied with their telemedicine experience, but 3/4 of people still reported that they would prefer the in-person visit. Again, there's pros and cons to in-person and telemedicine opportunities for care, but it's great that it's potentially an option that we can use moving forward as well. And as Leann said, we're interested to understand how this was influencing participation in research. Certainly many research programs were either shut down for a brief period of time, or visits were canceled or rescheduled, or study components were changed. But despite all of that, 94% of people still reported that they were willing to participate in research moving forward. And we certainly appreciate all the time and flexibility of that participating in research, the people that participate in it provide. And we know that research teams are certainly working hard to make sure current studies stay on track and that study visits go smoothly, as well as maintaining everyone's safety. So certainly it was great news to us that the pandemic did not stray people away from participating in research endeavors. So in conclusion, I would say that COVID-19 had a modest impact on people with muscular dystrophy, including FSHD. The perceived stress scales were similar to what we were finding in the general population. Rest, exercise, and meditation were commonly reported ways of managing stress, and that exercise, pain management, and stress management may have a positive impact on the disease. And certainly, thank you to all the survey participants that provided their answers to our questions, and we certainly appreciate all the support from the patient advocacy groups that helped us distribute the survey.